Hello and welcome to the NMS Health Talks podcast, a show where we discuss NMS operations and the broader health sector. For this episode, we are delving into maternal health. And with me in studio is Sister Nakamatte Florence, a seasoned midwife with Kisenyi Health Talks. She's going to be sharing with us her experiences, expert tips, and insights into maternal health care and how to ensure safe deliveries. Without further ado, let's dive right in. So, Sister Florence, please tell us about yourself.
Nakamatte Florence, a midwife, a registered midwife. I've worked for over 14 years, delivering mothers and saving babies. I work with Kisenyi Health Talks, and particularly now in antenatal clinic. Yes.
Okay, so you have said you have worked as a midwife for 14 years.
For 14 years.
The first time you delivered the baby, what was that experience like? What did you feel?
Saving a life, you really feel so happy. And when I delivered the mother and the baby cried, I really felt so good. I was like, is this where I also came from? So it gave me more energy of delivering more mothers.
Okay.
Yeah.
And how old were you that time?
By that time, I was around 26.
26 years. Wow.
Yes. 26 years.
Okay. So you have mentioned that you're in charge of the antenatal clinic at Kisenyi Health Talks. In your opinion, when is the right time for pregnant women to attend antenatal care?
Pregnant mothers, as long as the mother gets to know that I'm pregnant, they should seek out, they should go to the health facility immediately. Because the earlier, the better, the complication can be treated. But when they come late, you might find the complication can't be treated. Yes.
Usually what complications do pregnant mothers, which complications have you come across dealing with pregnant mothers?
Most of them get hypertensive disorders that can really complicate their pregnancies, getting abortions, also losing a mother, and then also anemia. You find mothers are not eating well to get those iron supplements. So when they come early, you can give iron supplements, and then you correct the anemia. And then you save a life.
Okay. So you have talked about hypertensive disorders. Those ones also usually come within the first trimester?
Yes, especially those mothers who are having their first babies. They normally get those hypertensive disorders. And then those who have delivered so many children, is mainly common. Yes.
Okay. So what is the role of a midwife?
The role as a midwife, first of all, you have to give a proper antenatal care. This is where you give regular visits, and on each visit, you have to give different service. Now, let me say on the first visit, you have to book this mother, that is filling her antenatal card, taking her histories, and then also removing investigations, that is HCT, HB, the group. And then also during antenatal.
What is HCT? What is HB?
That is estimating their blood volume. And then also testing the HIV. And then also we need to know their blood group. And then another thing, during antenatal, this is where we address those risks early, the high risks. Let me say the mother is non-hypertensive, has been taking antihypertensive drugs. She needs an eye or extra care. And then maybe mother is carrying more than one child. So that is some of the proper antenatal care. Also giving the essential drugs like the iron supplements, preventing malaria by giving them fansida, and also encourage health educating them on keeping well during pregnancy. And then when it comes to labor ward or maternity, first of all, the midwife has to be with skills of delivering this mother, proper monitoring of labor on a pathograph. It's a tool we use in monitoring mother's labor progress. So using that tool helps you to identify where the problem is and then address it early. You intervene in early. Also, proper use of a pathograph helps us to know the baby well-being. That is listening to the fetal heart.
Before the baby is delivered?
Yes.
Okay.
Because if you don't do that, the mother might progress well and then you end up with a dead baby. So you take care of the mother as well as the baby.
Okay.
And then another thing also, infection prevention. As you're conducting a delivery, you make sure you use aseptic techniques. These are some of the things we follow as you're conducting a delivery. If you're supposed to put on sterile gloves, you put them on. Sterile instruments, you use them. And then the place where the mother is delivering has to be clean. And also ensuring that you provide the immediate care to this newborn. That is making sure our baby is dry, the baby is warm, the baby is breastfeeding very well.
I like that you have brought in the aspect of taking care of the baby immediately after they are delivered. So we cannot discuss maternal health without talking about the child or the baby,
of course,
after they are born. So the role of the midwife is in three parts from what you have discussed. The antenatal care, then the process of the labor, then after
postnatal care.
Postnatal care.
Yes.
Okay, that's good to know. So usually in Uganda, I think in public health facilities, they usually advise men to attend antenatal with their women. Is there any specific reason why that is required?
Yeah, as Kisenyi Health Center we really encourage our mothers to come with their husbands. We give them priority. First priority. When you come with a husband, you're worked on very fast. So why we need these men to support their wives? First of all, we need to know their HIV status. The mother might be negative and then the partner is positive. Then you find you're seroconverting to the child. So you end up delivering a sick baby. Then another thing why we need these partners. There are things we teach these mothers, like, let me say, the danger signs during pregnancy. We might teach the mother and she forgets. But if the partner is there, the partner can remind her or can help when that danger sign happens.
Okay.
And they seek health care. Then another reason why we need them, in case this mother comes to deliver, they really need that support, reassurance, and then also providing the needs for the mother to get a safe delivery.
Okay.
Yes.
So in your opinion, what are the biggest challenges that expectant mothers face? We can look at the case of Kisenyi Health Center for
Kisenyi. Financial issues. You find most mothers come from far to seek a service in Kisenyi. You find they don't have transport. They don't have even food. So Coming to Kisenyi, let me say every after a month, because they give antenatal visits monthly. You find she has missed a visit because she doesn't have transport. She didn't get what to eat. And then also, there is another issue of culture. Some of them are told you can use the local herbs. They are okay even if you don't go to the hospital. They can be helpful. So those cultural barriers and beliefs. And then lack of awareness. Some mothers are not aware that they are supposed to attend antenatal when they become pregnant. So you find she becomes pregnant, she doesn't know what to do. So that awareness also affects them.
Now, on that cultural barriers that you have talked about, let's bust this myth. Is it true that there are some things that a pregnant woman can take to help them have a painless delivery, or that they will deliver in like 5 minutes? So, usually hear people saying you take this clay. Is it clay? Or there are some herbs that they take, or some things they tie. What is the truth?
The truth is they shouldn't be using those herbs because they really affect our baby. What those local herbs do, when you take them, they'll bring more oxytocin. Oxytocin is a drug that brings contraction. They'll bring more contraction.
Okay.
And then this mother ends up with a very asphyxiated baby or a tired baby. Or the mother might end up rupturing the uterus because the contractions are excessively. So I really disagree with mothers using local herbs to quicken their labor. Instead, they're risking their lives.
That is unfortunate. Okay. Thank you so I hope mothers out there have taken this message that those herbs they are taking to quicken or give them a painless labor, on the contrary, they could be bringing them closer to their death.
Yeah.
Or even the death of the baby. Okay. So, in your opinion, how has NMS contributed to safe deliveries at Kisenyi Health Center?
Really, NMS has helped to save a life. Let me say a lot of lives. The sundries we get. First of all, the sundries help us to prevent all infection control and prevention between the mother and then the midwife. And then the drugs, let me say the hematinics, those are the things, the iron tablets, the folic acid, the antimalarials, they're really helping. Because if we go short of those drugs, you find you're getting mothers who are anemic, mothers with malaria, and malaria can complicate the pregnancy, maybe by killing the baby from the uterus, or it can even cause more anemia. So, NMS has also helped us in easing handling emergencies. They're giving us those emergency drugs, the equipment we use in emergency. So you find when you get an emergency, it's really easy to attend to that emergency.
Okay.
Yes.
So on the topic of sundries, mama kit's also part of sundries?
Yes.
Okay, so what is a mama kit? Who gets the mama kit? When do they get it? And what is contained in the mama kit?
So a mama kit is like a collection of, let me call them equipments that we use during delivery for giving a clean and a safe delivery to the mother. And they contain a cotton, 5 pairs of gloves, blade for cutting the baby's cord, gauze, 2 rolls of gauze. We have the Macintosh. We have the one for the baby and then for the mother.
That is Macintosh.
Yes.
Okay.
I can call it Kavera. They're the Macintosh. And then we have the threads that help in tying the baby's cord. So really when you have that package, you deliver mother in a good way. Even prevent infections.
Okay.
Yes. And then these mama kits, we normally give them to mothers who are in 3rd trimester. Why? Because we see them like they'll benefit more. And they're almost due to delivery.
Okay. So do you give them immediately when they enter the 3rd trimester, or like when they come in for delivery, like when their expected date of delivery has arrived? Like when do they get them?
No, we give them during antenatal. So, yes.
Okay.
When they come in, all mothers in the 3rd trimester, we give them. Even if she has come for the first time, because we even get those who are due, they are coming for their first time for antenatal. So we give them. And then there are also those particular mothers that come with nothing. Maybe they missed attending antenatal. So we also give them from labor.
Okay.
Yes.
Okay. That's a good one. That's good to know. So what are the leading causes of maternal mortality in Uganda? And is there a way they can be prevented?
Okay. The leading causes of maternal mortality, one is hemorrhage. Hemorrhage, this is when the mother bleeds maybe after birth or following an abortion. That is the first that she's killing mothers. And then another thing, hypertensive disorders, where we get the high blood pressures, preeclampsia and then eclampsia.
Okay.
They're also killing mothers. Then
I think recently there's a female doctor who passed to preeclampsia.
Yeah.
I remember the story was on social media. It was really unfortunate.
So those hypertensive disorders, they also contribute to the maternal mortality. Then sepsis or infections.
Oh, yeah.
Like maybe following a criminal abortion, not giving a clean delivery. Yeah.
A criminal abortion is what?
A criminal abortion, let me say, a mother becomes pregnant and then decides to terminate it, maybe by herself. Yes.
Okay. So how can pregnant women prevent those sepsis infections that you have talked about?
Those causes of the maternal mortality.
Yes.
So first of all, we should start with the community. We need to sensitize the community. And then they make the community aware of going for antenatal, seeking for health services in time. And also during antenatal, we have to give proper antenatal care, where we screen those who are at risk and also preventing the risks from occurring.
But usually what causes those infections? Is it that people are not paying, I don't know. What, in your opinion?
Sometimes not following, like I said, the septic techniques. Sometimes we don't have antibiotics.
Is that at the point of delivery now, or while like a pregnant, okay, like while the full term of pregnancy, those 9 months, like how can women, because I know pregnant women struggle with infections. How can that be prevented?
How
Is
can-
there anything that pregnant mothers can do?
First of all, when someone is pregnant, their immunity lowers. So we encourage these mothers to make sure that they prevent themselves from getting these infections. Let me say malaria. We encourage them to sleep under mosquito nets, taking their fancy downtime, and then when they get anything like a fever, to report such that we treat early. Yes, that is during antenatal.
Okay. So it still comes back to antenatal. People should really attend antenatal.
Yeah.
I understand. In 2022, Kisenyi Hospital was awarded for safe motherhood.
Yes.
In the whole of Uganda. Is it the whole of Uganda? What was that like?
One of the successful stories, male involvement. Every Monday to Friday, we run a clinic for male partners who come with their wives, which teach them how they can help their wives to keep well during pregnancy.
Monday to Friday.
Monday to Friday.
Okay.
And then we teach them about the danger signs and also supporting them when they are coming to the facility. This thing has really helped so much in fighting mothers who die from homes, not being able to reach the facility because their husbands are aware of what to do. And then another successful story, the meetings. We normally have evaluation meetings every Thursday in the MCH department, where we sit and look at those bad cases. Let me say a mother lost a baby. Then we see where we went wrong such that it doesn't reoccur.
Okay.
Yes.
That's a good one.
Then also the quality improvement projects. Every department has a quality improvement project it runs. So it helps us to see where our gaps are, where we need to put more energy. So now, like antenatal, our quality improvement project is on mothers coming early for antenatal in the first trimester. Yes, we want to increase the number of mothers coming for antenatal in the first trimester.
Okay. On that, you mentioned that you deliver around 800 mothers in a month. Of that number, how many would you say attend their antenatal in the first trimester?
About 800 of those who deliver. And around like 200 who come in their first trimester. Yes.
Okay. So there is still a lot of work to be done in that area. Okay. You know, our general manager usually says that the biggest room is the room for improvement. So, and I have liked that you're taking on all these initiatives to try and improve safe motherhood and make sure that women who come to Kisenyi Health Center to deliver their babies are in safe hands. We must applaud you for that. You're doing a good job.
Thank you very much.
And now on community, you mentioned that you have a program on male partners. You know, when they used to tell us that bringing up children takes a village, a community, but I think now, in this case, self-delivery has also become a community. It's now going to take a community. We need everyone to be on board.
Yes.
So you need the mothers, then you also need their husbands, then you also need their neighbors.
Yes.
To come in and help in case anything comes up.
Because there are scenarios we get, you find the mothers come, ask how was escorted. You, my neighbor. So you see how also the neighbor is helping.
Coming in.
Yes.
So we want to thank all the neighbors out there, the good neighbors, and even the partners, the male partners who are showing up for their pregnant women to ensure that they are safe, that they have everything they need, that they attend antenatal, so that we can have safe deliveries, because that is really what we want. When we talk about maternal health, it is actually a topic that touches at the heart of every family, because every family is, you have a mother, you have a father, you have a child.
Yes.
So safe motherhood is for all of us.
Yes.
Okay.
That's true.
So, Sister Florence,
Yes.
are there any expert tips that you would, we have been talking about we have been talking about maternal health. Now we can talk about that bit of the postnatal after the children have come out. What would you advise a woman who has just given birth to do to ensure that their child is safe, that they are well taken care of? Like, is there anything in particular they need to do?
Normally when these mothers deliver, we encourage them to maintain warmth for their baby and not covering them so much, because when you overcover, then you
Also a problem.
is a problem. So we teach them on what to do.
Okay, because on that one, let me give you this story. I have a relative who overcovered the child. The child got sick and they had to run the child to the hospital. I think like 2 days from delivery. They ran to the hospital, and when they got to the hospital, the only thing the nurses did was to uncover the child. So when you say warm, people may not know that also overcovering becomes a problem.
So they should cover, but not overcovering. And then we teach them to breastfeed their babies. Not that the child shouldn't first demand, but they should breastfeed them regularly.
So
Because it helps.
how long is that regular?
It can be 1 hour, depending. Might find a mother has not enough breast milk and it takes like even 30 minutes, the baby cries. You give the breast.
Okay.
Or 1 hour. And then we encourage them, they shouldn't leave their babies to because the baby is sleeping, and then you deny a breast.
So even when the babies are sleeping, they are supposed to,
as long as
find a way to give
one
the breast.
You need to feed this baby. Yes.
Okay, because I know some babies can actually sleep the whole day.
Yes. So you wake them up and give a breast. Your mother has to breastfeed exclusively for 6 months. And after 6 months, that's when she can introduce in another feed. Maybe milk, porridge, food from 6 months. But because we have also those working mothers, they tend to do exclusive for 3 months. And then they start mixing.
Sometimes even less than 3 months, because when you say 60 working days, that's actually not 3 months. That's less.
2 and
some days. Yeah. Then now you have to be away for over 11 hours.
You find you're only breastfeeding at night.
Yeah. Though some people can actually pump their kids. For some people, they are not able to pump, so you have to give those other things.
Yeah.
Okay, so Sister Florence, we have really had a very insightful conversation. And I know maternal health is so broad. We can sit here and talk the whole day. We shall not be able to finish. As your parting shot, any message you want our listeners, especially the women? No, we are in March. It's the Women's Month.
Yeah.
That's why we decided to actually talk about maternal health.
So, first of all, I would advise our expectant mothers or mothers of a bearing age to keep themselves healthy by eating balanced food. And then when they get to know they are pregnant, they should go to the health facility that has skilled health personnel And then also, when it comes to delivering, they should go to the right places where people are skilled. Because every mother deserves a safe and clean delivery. And then every child really deserves a healthier start. Our babies shouldn't start when they are sick. So when we give our health delivery and also to our babies, we are giving a healthy family, a health community. So my advice is always to seek health care.
Thank you so much, Sister Florence. You're welcome. That was it for our episode today on maternal health, and I have liked how Sister Florence has put it, that every mother deserves a safe delivery and every child deserves a safe start in life. So there isn't much I can add there, but I hope you enjoyed this episode as much as I have. It was really insightful, inspirational, full of nuggets, for the mothers out there. So as always, I remain Ash, your host for the NMS Health Talks podcast. And please, I would like to thank our viewers, our community who have been with us since the first episode. And I would also like to encourage others to subscribe, like, leave a comment. And you can tell us if there are any topics you would like us to cover on the NMS Health Talks podcast. Thank you so much. Ciao.